Hi guys, my name is Bianca.
Hello, my name is Nadine.
And we're going to be talking to you guys about hypertension and heart disease. So for today, our learning objectives would be to define hypertension, and we'll review what normal blood pressure is, what patients with hypertension, their blood pressure looks like, and patients who have low blood pressure. We're also going to review how to manage your blood pressure and habits to apply to decrease the workload of the heart. And also assess your prior knowledge towards hypertension and heart disease, and also hopefully at the end of this presentation you'll gain a little bit more knowledge about hypertension. So today we're just going to take a pre and post test. I'm going to hand it out to you guys. If you guys can take it, I'll give you guys a few minutes. Okay, now that we all finished taking the test, we'll just go over it. So the first one says normal blood pressure in adults is, and the answer is going to be A, 115/75. The second question would be risk factors that can affect blood pressure are, and the answer is E, all of the above. So smoking, stress, diabetes, and obesity can all be risk factors that can affect the blood pressure. The third one would be a diagnosis of hypertension cannot be made from one blood pressure reading, and that is true. You don't need just one high blood pressure to define that you do have hypertension. How can you manage blood pressure? And the answer is D, all of the above. So not smoking or drinking, exercising weekly, and eating a healthy diet. Let's see. How often should you check your blood pressure? And the answer is C, 3 times a day. You should check one in the morning, one in the afternoon, and one at night. And the last one example of a DASH diet includes A, it's oatmeal, chicken breast, sandwich, and spaghetti. Not too much though. Okay, so after assessing your prior knowledge, depending on how much you got wrong or you got right, I'll just let you guys know what hypertension is. So hypertension is consistent blood pressure readings over 140/90. That's according to the CDC. So normal blood pressure is usually when your systolic blood pressure, the top number, is less than 120 and the diastolic is less than 80. Patients who have pre-hypertension, their systolics would be around 120s to 139, and their diastolic would be the bottom number of 80 to 89. And then finally, patients with hypertension have a systolic of 140 at the top or higher, and a diastolic of 90 and higher. So who is at risk? Nadine will go over that in her section as well. But I want to also talk about the DASH diet, because the DASH diet is one of the things that you can do to help manage your condition. So the DASH diet is determined that the greatest reduction of blood pressure occurred in those with the lowest salt intake. The benefits of salt restriction on health and lifespan are not clear-cut, but the DASH diet studies show that it has helped manage the condition of hypertension. So it was designed to reduce high blood pressure. So the DASH diet is rich in fruits, vegetables, lean proteins, and it restricts red meat, salt, and added sugars in the diet, and fat. So as far as with hypertension, patients with hypertension can also develop heart diseases, and Nadine will go ahead and talk to you more about hypertension, heart disease, and other
Hi everybody, so my name is Nadine, and now I'll be presenting heart disease. I'll be giving you some facts about heart disease, statistics, some risk factors, what the signs and symptoms are, and how to manage heart disease. But first, let me test your knowledge by giving you a pre-test so I can see how much you know about heart disease. Okay, so before I go over the test, I will give you some facts about heart disease, and then we'll check it over during the post-test. So heart disease refers to several types of heart conditions. It's such as coronary artery disease, which is the most common, heart attack and other conditions such as AFib and other heart conditions. Statistics about heart disease is that it's the leading cause of death in men and women in the United States. About 630,000 Americans die each year, making it 1 out of 4 people in the United States. Someone dies from heart disease every 40 seconds. And in the US, heart disease causes companies $200 billion each year. So some signs and symptoms of heart disease include chest pain, upper body discomfort, and shortness of breath. So any of these symptoms should be reported to a primary physician or get immediate help as soon as possible. Risk factors are modifiable and non-modifiable. Modifiable will include stress level, blood pressure, cholesterol level, smoking, diabetes, obesity, poor diet, physical inactivity, excessive alcohol use. And non-modifiable factors would include your age, your sex, family history of it, or your race or ethnicity. So there are many ways to manage heart disease. First, it's important to keep your blood pressure and cholesterol level and your sugar level normal. Also, eating healthy, the DASH diet, which Bianca talked about, is effective. Maintaining healthy weight, exercise especially, and avoiding smoking and limiting your drinking. And now we can go over your post-test to see how many questions we got right. So the first question stated, what is the leading cause of death for both men and women in the United States? So like I said, it was heart disease is the answer. And the second question is, which of these are major warning signs and symptoms of a heart attack? Signs and symptoms of a heart attack include chest pain or discomfort, upper body pain or discomfort, and shortness of breath, making it all of the above. Number 3 is, which of these is a modifiable risk factors for heart disease? Modifiable risk factor would be your physical inactivity, because age, sex, and race would not be something you can fix. Number 4, which one of these is not a part of a healthy lifestyle? And not part of a healthy lifestyle would be smoking tobacco, letter C. And finally, true or false, heart disease can run in a family. The answer is true. Thank you.